Good evening and welcome to my channel. So today we will discuss about something that is very important in reaching to a diagnosis. Whenever patient comes to you, so there is expectation in the mind of the patient that this doctor, this person is going to solve my problem. This person have a solution to my problem, my disease. So, how you will reach to your diagnosis? Until unless you reach to your diagnosis, you will not be able to give a proper solution to his problem. So, when you are not able to give any solution to the problem of the patient, that means you are a totally failure. So, you must need something on the basis of which you can diagnose the problem. Until unless you are able to diagnose the problem of the patient in a correct way, you will not be able to solve the problem. That means you will not be able to give a proper specific treatment to the patient. So when you are not giving a specific treatment, that means you are just giving symptomatic treatment. So patient will come to you once, twice. एक या दो बार आपके पास आएगा और उसके बाद वो हो सकता है कि किसी और फिजिशियन के पास चला जाए. तो इसीलिए फॉर ऑल दीज रीजंस वी हैव टू टेक द प्रॉपर हिस्ट्री ऑफ द डिजीज ऑफ द पेशेंट, द सफरिंग ऑफ द पेशेंट, द प्रॉब्लम ऑफ द पेशेंट. तो यही हिस्ट्री है. So part of that history also contains some personal details of the patient. So these two things, disease and some personal details, will constitute your total history. So history is what you will ask from the patient. So after taking history from the patient, you will have something in your mind that patient may be suffering from this problem. So you will confirm your finding by doing the examination. That means finding of the history will be confirmed by doing the examination. And then now you have two findings, one of the history, one of the examination. And on compiling the two, you will reach to a certain diagnosis. There may be some one or two diagnoses, that means probable diagnosis you can have. So now you have two things, two findings, and you have to, and these two findings are coinciding each other. Now you have to confirm these two findings. How you will confirm these two findings? So by combining these two findings, you will suggest some investigations to the patient so that you can confirm your finding of history and the examination. आपने जो हिस्ट्री में जो डिटेल्स पेशेंट से ली, अब आपने एग्जामिनेशन किया डिपेंडिंग अपॉन द फाइंडिंग्स ऑफ द हिस्ट्री. नाउ यू हैव टू थिंग्स. आपके पास अब दो फाइंडिंग है, एक हिस्ट्री की और एक एग्जामिनेशन की. दोनों को मिला के आप एक डायग्नोसिस पे पहुंचे कि दिस कुड बी द पॉसिबिलिटी दैट द पेशेंट इज सफरिंग फ्रॉम. यू आर नॉट स्टिल नॉट कन्फर्म्ड. सो व्हाट यू विल डू? सो एट दिस पॉइंट हम क्या करेंगे, पेशेंट को कुछ इन्वेस्टिगेशन लिख के देंगे या पेशेंट से कुछ इन्वेस्टिगेशन करवाएंगे अपनी दो फाइंडिंग, हिस्ट्री और एग्जामिनेशन की फाइंडिंग को कंफर्म करने के लिए. जब हमारी तीन फाइंडिंग्स अब हो गई, हिस्ट्री, एग्जामिनेशन एंड द इन्वेस्टिगेशंस, सो व्हेन दीज थ्री विल कंसाइड विद ईच अदर, हिस्ट्री की फाइंडिंग को हमने कंफर्म किया एग्जामिनेशन से, इन दोनों की फाइंडिंग को हमने कंफर्म किया इन्वेस्टिगेशन से. सो दीज इन्वेस्टिगेशंस कुड बी योर एक्सरे, सीटी स्कैन, एमआरआई एंड द ब्लड बायोकेमिस्ट्री. सो वेरियस काइंड ऑफ टेस्ट डिपेंडिंग अपॉन द findings of history and examination, we can advise some investigations to the patient. So now we have reached to a diagnosis, and on the basis of diagnosis we have to prescribe some medication, some treatment to the patient. Now here comes the role. So for a single disease, it is not that you have only one option of the treatment. There are many options depending upon the patient financial condition, education status, and past history of the patient, medical history. You can modify the treatment, and according to the patient's condition we can give some treatment option to the patient. तो ये सारा जो चीज़ है, जब हम ट्रीटमेंट स्टार्ट करेंगे उससे पहले की जो सारी कहानी है वो हमारे को समझना बहुत ज़रूरी है. इसलिए हम हिस्ट्री लेते हैं कि हम एक प्रॉपर डायग्नोसिस तक पहुंच सकें. डायग्नोसिस नहीं होगा तो ट्रीटमेंट करेक्ट नहीं होगा, ट्रीटमेंट करेक्ट नहीं होगा तो पेशेंट की प्रॉब्लम सॉल्व नहीं होगी. So now comes the main part, that is history taking. So how we have to take the history? So first we have to ask the name of the patient. पेशेंट का नाम पता करेंगे. देखिए, पेशेंट जब आपके पास आया तो वो एक अनजान है, वो आपको नहीं जानता, आप पेशेंट को नहीं जानते. सो सपोज़ आप कहीं ट्रैवल भी कर रहे हैं, आपकी पड़ोस वाली सीट पे कोई बैठा है, तो वो आपके साथ इतनी जल्दी अपनी पर्सनल डिटेल्स वगैरह शेयर नहीं करेगा. हो सकता है कि आपके बीच में कुछ बातें हुई हों तो आपके इंटरेस्ट मैच करते हैं, यू आर फ्रॉम द सेम प्लेस. तो धीरे धीरे जब रैपो एक दूसरे के लिए बढ़ती है, एक दूसरे को आप जानने लगते हैं, तो आप कुछ पर्सनल डिटेल्स शेयर करते हैं, नंबर शेयर करते हैं, फैमिली डिटेल्स भी शेयर कर लेते हैं. सो दैट only when you know that the person in front of you is more familiar to you, it is, and that that person is just like you. उसकी जो हॉबीज़ हैं, उसकी जो लाइकिंग है और उसके बाकी तौर तरीके लोगों को समझने का, वो सारे आपसे मिलते जुलते हैं. तभी आप उनके साथ घुल मिल के नंबर शेयर करोगे या और भी कुछ. सिमिलरली जब पेशेंट आपके पास ओपीडी में आता है तो वो आपको नहीं जानता, आप पेशेंट को नहीं जानते. इमीडिएटली जब आप बम्बार्डमेंट कर देंगे क्वेश्चंस की, क्या तकलीफ़ है, क्या है, आपने ना नाम पूछा, ना कुछ पूछा, ना पेशेंट के साथ रेपो बनाई, आपने एक बम्बार्डमेंट कर दी क्वेश्चंस की एक के बाद एक. जैसे ही पेशेंट आपके पास आया, आपने कुछ सवाल पूछे, अब उसने जैसे तैसे खुशी में जवाब दिए या ना खुश होकर जवाब दिए, आपने कुछ एक दिमाग में एक ट्रीटमेंट बनाया और वो पेशेंट को लिख के दे दिया, जाइए आप ये टेस्ट करवा के लेके आइए. लेकिन पेशेंट इतने से सेटिस्फाई नहीं होगा, क्योंकि जब पेशेंट आपके पास आता है तो उसकी एक एक्सपेक्टेशंस होती हैं कि जिस डॉक्टर के पास, जिस फिजिशियन या क्लिनिशियंस के पास वो जा रहा है, तो वो उसकी बात ध्यान से सुनेगा. So whenever patient comes to you, first of all you have to greet the patient. उसका जरा थोड़ा सा स्वागत कीजिए, उसको थोड़ा सा प्यार से बात कीजिए कि आपका नाम क्या है, आपको क्या तकलीफ़ है. जो अगर आप बुरा ना माने तो मैं थोड़ी सी आपसे जानकारी, जो आपकी तकलीफ़ है उसके बारे में जानना चाहूँगा. तो पेशेंट को भी लगेगा हाँ, थोड़ा सा शायद ये मेरी कुछ हेल्प कर सके. अब आप ये कभी मत सोचिए कि जब पेशेंट आपको एग्ज़ाम में मिलता है तो वो पेशेंट आपको पास भी करवा सकता है, पेशेंट आपको फेल भी करवा सकता है. तो पेशेंट बड़ा समझदार होता है. जो अगर कई बार पेशेंट के साथ आपकी रेपो बहुत अच्छी है, आपने बनाया, अच्छे प्यार से बात करी, जो अगर कुछ क्वेश्चन एग्जामिनर ने पूछा आपसे, हो सकता है कि आपने पेशेंट से ना पूछा हो. जब पेशेंट देख रहा है कि एग्जामिनर से क्वेश्चन पूछ रहा है और इसने मेरे से ये नहीं पूछा, तो कई बार हमने अपने लाइफ में, जब हम स्टूडेंट्स थे तब हमने कई बार ऑब्जर्व किया, पेशेंट इमीडिएटली बोलेगा सर ये डॉक्टर साहब ने हमारे से पूछा है. जो अगर पेशेंट की रेपो आपके साथ अच्छी नहीं है, जो अगर आपने पूछा भी होगा तो पेशेंट या तो ठीक से जवाब नहीं देगा और इमीडिएटली बोल देगा नहीं जी इन्होंने हमारे से ये पूछा ही नहीं. तो इसीलिए जब भी पेशेंट आपके पास आता है, सबसे पहले आप उसका नाम पूछिए, पेशेंट कहाँ से आया है, क्या तकलीफ़ है. तो बड़े जब भी आप उसको पूछेंगे तो ये सारी चीज़ें, एक रेपो जब आप बिल्ड कर लेंगे, देन यू कीप ऑन आस्किंग अबाउट द प्रॉब्लम. अब आप मेरे को बताइए आपको क्या तकलीफ़ है. तो पेशेंट आपको बताएगा कि मेरे को ये तकलीफ़ है, 4 दिन से है, 5 दिन से है. तो तभी आपको बताएगा जब एक वो कॉन्फिडेंस बिल्ड हो जाएगा. The first thing that we ask from the patient is the name of the patient. So this name has two most important, you can say the important thing attached with the name of the patient. फर्स्ट इज इट बिल्ड्स द रेपो, एक जानकारी. जब आप पेशेंट को नाम लेके बुलाएंगे, नेक्स्ट टाइम जब पेशेंट आएगा फिर आप उसको नाम लेके बुलाएंगे तो पेशेंट को लगेगा कि हाँ ये मेरी चिंता करता है, इसलिए इसको मेरा नाम भी याद है. और किसी को भी आप जब नाम लेके बुलाते हो तो उसको अच्छा लगता है. आप बताओ कि रेड टी शर्ट पर्सन विद स्पेक्स, हाँ जी आप कहाँ से आए हैं, बाबा जी है, तो पेशेंट को भी वो अच्छा. जब आप उसको नाम लेके या एक रिस्पेक्ट दे के बुलाएंगे तो उसको भी अच्छा लगेगा, वो आपके साथ ज़्यादा चीज़ें शेयर करेगा. दूसरी जो इम्पोर्टेंस है दैट इज़ ए मेडिको लीगल इम्पोर्टेंस. दैट नेम सेपरेट्स द टू पर्सन. सपोज इन अ वार्ड पेशेंट इज़ एडमिटेड and the similar name another patient, so here the name of the patient will separate the two patient. Specifically उसका सरनेम के साथ जब आप उसको लिखेंगे, नाम उसका पता करेंगे तो एक अलग पहचान उसकी होगी. ये तो होगी एक चीज़. दूसरा है एज ऑफ द पेशेंट. सो एज इज़ वेरी इंपॉर्टेंट बिकॉज मैनी प्रॉब्लम्स आर एसोसिएटेड विद द एज ऑफ द पेशेंट. कुछ प्रॉब्लम होती हैं. सपोज वी स्टार्ट विद द बर्थ ऑफ द पेशेंट. पेशेंट वो आपका छोटा बच्चा एट द टाइम ऑफ बर्थ भी हो सकता है, टॉडलर भी हो सकता है, चाइल्ड भी हो सकता है, मिडिल एज, एडल्ट एंड द एल्डरली पीपल. सो जैसे जैसे स्टेज बढ़ती जाती है उसी हिसाब से कुछ डिजीज़ की होने की प्रोबेबिलिटी वो भी बढ़ती जाती है, कुछ की कम होती जाती है. सपोज़ एट द टाइम ऑफ बर्थ कुछ डिजीज़ हैं जो बर्थ के टाइम पे प्रेजेंट होती हैं. तो जैसे आप ये ले लीजिए कि क्लेफ्ट लिप, क्लेफ्ट पैलेट जो है वो आपको बर्थ के टाइम पे पता लगता है. सैक्रोकॉक्सिजियल टेराटोमा वो आपको बर्थ के टाइम पे पता चल जाएगा. दूसरा ये है कि फाइमोसिस. फाइमोसिस मीन्स नैरो प्रीप्यूस एंड दैट infant will not be able to properly pass the urine. You will find that whenever that infant tries to push the urine, there is a bulge in the prepuce and there will be pin like thin stream of the urine will be there. So कुछ प्रॉब्लम होती हैं जो होती तो बर्थ के टाइम पे, लेकिन वो लेटर ऑन बाद में जाके प्रेजेंट होती हैं. सो ऐसी कौन सी प्रॉब्लम है जो बाद में जाके, जैसे आपका हो गया परसिस्टेंट यूरेकस. यूरेकस इज ए रेमनेंट दैट अटैचेस द अम्ब्लाइकस विद द डोम ऑफ द यूरिनरी ब्लैडर. ब्रेंकियल सिस्ट हो गया, ब्रेंकियल फिस्टुला हो गया. दीज आर द सिस्टिक swellings of the head and neck, and when the cyst ruptures there is a constant discharge and that form the fistula. Similarly, that another swelling, that is cystic hygroma, that is lymphangioma, that is also a head and neck swelling and which is present at the time of the birth, but that you can say the congenital branchial cyst, though it is congenital but it presents late in the life of the patient, maybe at the age of 6 months, 1 year. So these are the things. So depending upon at which age the swelling appeared in the head and neck, so we can make whether it is a cystic hygroma or something else. So next is the childhood. So in case of childhood, one more thing, congenital thing, you can also have congenital inguinal hernia that may be present. So at the time of birth there may be absent testis. So this is congenital absence of the testis, or you can say undescended testis may be there. So these are the things that you can observe at what point of time the swelling has appeared. So if swelling appears in the head and neck, that is a branchial cyst, will appear later in the life. That means not immediately at the birth you will find that any swelling, but maybe after 6 months to 1 year. Similarly, now the younger age group between the 14-15 age, at this stage you will find that so now after birth, now the infancy, that is infants. So in infants you will find that acute osteomyelitis, acute arthritis, these are the common things which are present. And in case of malignant tumors, generally we find that malignancy occurs in the elderly or middle aged people. It is not like that. Though these are common in those age groups, but Wilms tumor is one tumor that appears in the kidney and it is common in infants. So these diseases have certain, you can say, the predilection for your certain age groups. Similarly, in case of 13 to 14, specifically in the females, you will find that chances of acute appendicitis are high. So in this way, if we keep on increasing the age of the patient, so in that case we will be able to make out the diagnosis if the patient is in the infant or at the time of birth we found this. It could be a cystic hygroma, it could be a something else. So in that way we can make out the diagnosis. Now comes your teenage. So in that age the problems associated, as I said, that in case of females acute appendicitis is more common. Similarly, in children also sarcomas are more common as compared to the middle age people. Now comes the sex of the patient. Sorry. Now comes the adulthood. In adulthood, there are certain problems which are common. As the age increases, the chances of malignancy also keeps on increasing. So though the malignancies in adulthood are common beyond the age of 40 years, but it is not the, you can say, the exclusivity that these malignancies will exclusively be present in the age beyond 40 years. So as we have discussed the Wilms tumor, and with the increasing pollution and various other kinds of chemicals that we are exposed to, the chances of malignancies are increasing in the younger age group also. And in case of elderly people, there are many problems associated with the elderly people. In case of females, problems associated with the cervical infection, cervical carcinomas. In case of males, benign enlargement of the prostate that can cause urinary obstruction or intermittent urinary obstruction, thinning of the stream, dribbling, all these are the problems. Similarly, in case of elderly people, you will find that the common thing that you can find sorry, these days is osteoarthritis of the knee joint. So these are just like joint in the any part of the, you can say, the machinery. Similarly in our body, these joints, so whenever two moving parts they rub each other, there is the possibility that there will be friction, and that friction can cause the erosion of the smooth surface, and ultimately there will be osteoarthritis of the joints. So these are the things, as you see, that from birth, then infant, then teenage, then the adult and the elderly people. So when you find that the patient with elderly patient comes to you with knee joint pain, so it is quite possible that the first possibility could be the osteoarthritis. If you find that the tumor is present in the infant, in the, so you can say the right or left flank. So your possibility could be on the basis of history and the examination that it could be a tumor originating from the kidney, it could be a Wim's tumor. So like this you can have something probable thing that will come into mind depending upon the age of the patient. Now comes the sex of the patient. So the diseases which are associated with the sexual organ will exclusively occur in the respective sex. Suppose in case of males, the prostate problem will occur only in the males because the prostate gland is present only in males. Similarly, in case of females, cervical problems, uterine problems, ovarian problems, these are present exclusively in the females. So these problems you will not be able to see in case of male patients. But there are certain problems which can occur in both patients. Similarly, in case of breast carcinoma, this breast carcinoma is more common in case of females as compared to the males. In case of males, the breast carcinoma is more dangerous because there is no fat below the breast tissue, and it in the early stages it can invade the deeper structures, muscles and the chest wall. That is sometime later in the evolution of the tumor in case of females because of the thick fatty tissue present in the breast. So other things that are common in case of females like protruding abdominal wall, that is known as visceroptosis. Second thing is that the autoimmune problems are more common in case of females like thyroid problems. Third problem that which are common in case of females are your cystitis. Cystitis means infection of the urinary bladder. The common cause of the cystitis in case of females is because of the short and the straight urethra, and the infection in the females usually travel from outside into the urinary bladder. Similarly, in case of male patient, so the chances of lung carcinoma, you can say the kidney carcinoma and the carcinoma of the stomach, so these are high as compared to the female patients. So similarly, if something happens and according to our experience that these kind of tumors, this kind of disease is occurring in the patient and we suspect that this could be the problem, and when we examine the patient and find that the patient is of the sex in which the disease is more common, so our chances of finding the same problem in that sex are high. So similarly, you can now make out the importance of age, importance of sex. Now comes the religion of the patient. So many problems are there which are exclusively present or not present in certain religions. So in case of Muslims, because of the custom of doing the circumcision in the at the time after just after the birth or in the infancy, so chances of carcinoma of the penis are almost negligible, and the chances of infection underlying the prepuce are also not there. So this is the one problem that is exclusively not present in case of Muslims. Now comes your sorry now comes the address of the patient. So this address, as the name suggests, that it has a medico legal importance and in building the rapport of the patient. Similarly, the address of the patient also carries medico legal importance, because many times when we find that two patients with the same name, same surname, We can only to differentiate them with the father's name and with the address of the patient. One thing. Second importance is that address tells us that from which state, which area the patient is coming from. So there are many problems that are associated with the particular area of the patient, that area of the residence of the patient. Suppose the carcinoma of the stomach, these are more common in the southern part because of the excessive use of various types of spices. Kangdi cancer is common in Kashmiris because of the excessive cold they used to carry a kangri under their jacket or under their garments, and that hot kangri that is used to produce the heat constantly irritating the abdominal wall. So constant irritation can cause the malignancy of the abdominal wall, and it is known as kangri cancer. Patient may be coming from the area where the certain problems are common, may be associated with the mosquitoes or any other kind of, you can say, the insects or mosquitoes. Second thing is that in that area the water may be polluted and the patient is drinking that water. So that could also cause some problems associated with the polluted water. Some problems are also associated with the, you can say, the polluted air. His residence may be nearby some factory which is producing either the dust particles or producing some chemicals into the air, and the patient is, or the resident of that area, are constantly inhaling those fumes. So they may be associated with the some increased chances of malignancy of the lung or respiratory problems, chronic bronchitis, asthma. So these kind of problems may be common in patients with certain areas. Now comes the, you can say, the personal habits of the patient. These personal habits of the patient are just like whether the patient is vegetarian or non-vegetarian. So some problems are more common in non-vegetarian diet, like you can say cysticercosis. If they eat uncooked, or you can say not properly cooked meat, so these cysts may go into their body, and then when the cyst wall is dissolved by the acids and alkali in the intestine, the larvae are released and enter into the hepatic stream. So through that it can go into the brain, into the muscle, into the lung, and other various distant places. So by this way we can make out that the the dietary habit of the patient. Similarly, these, as I have told, that these kind of problems are these days are also present. You can see that these problems you can see in case of vegetarian people also, because the vegetables which are grown are irrigated with the sewage water. So that sewage water may contain many cysts, and these cysts, if are consumed along with the unwashed vegetables, so you are consuming the cyst and you can suffer the same cysticercosis and other kind of worm infestation. Now comes the other habits like smoking and the alcohol. If the patient is a chronic smoker, so you can expect that he may be suffering from, you can say, the oral cancer, lung cancer, chronic bronchitis, tracheitis. And if that patient is suffering from some peripheral vascular disease, so you can easily suspect that the disease may be of small and the medium vessels, and the disease, vascular or arterial disease associated with the chronic smoking, is known as the Buerger's disease or thromboangiitis obliterans. Similarly, the chronic these smokers also have increased chances of urinary bladder carcinoma, that is transitional cell carcinoma. A patient is male chronic smoker and comes to you with sorry, with a history that he is having hematuria, that is blood in the urine. So you can easily suspect that it could be that, and it is your moral duty to rule out the carcinoma bladder. So though some stone passing from the ureter into the bladder may can cause hematuria, but still, according to the age of the patient, history of smoke, chronic smoking, so you have to rule out the carcinoma bladder. So these are the various things that you have to ask from the patient. So in the next video we will discuss what are the various things that other things that we have to ask. So in the next video we will discuss about the chief complaints. Chief complaint means what are the various complaints the patient is having, how we have to write those chief complaints, and then how we have to elaborate each complaint one by one. So please tune into my channel and subscribe it and wait for the next video, that is the chief complaints of the patient. Thank you very much and good night.